Hello, my name is Elaine Way and I'm Chief Executive of the Western Health and Social Care Trust. I'm very proud of the clinical cancer services that we provide locally, and I'm particularly excited about the development of the radiotherapy unit, which will provide cancer services for patients of the North West in Ireland. Patients and their families can be assured of the high quality services that are offered because they are externally accredited. However, I know as someone who has had members of my family suffer from cancer of the enormous emotional support that is required at a time when a patient receives a cancer diagnosis. And my purpose in speaking on this video today is really to encourage others to seek and find the support they need, either themselves as one who suffers from cancer or for their families. In the Western Trust, we have developed very strong partnership relationships with a whole range of voluntary organisations right across our geography who are expert in supporting patients. I know, having looked at the range of services that they offer, from spiritual support right through to the very practical financial advice, that if there is an issue you are concerned about, you will find help and support from them. I would also like to take this opportunity to thank each and every one of those voluntary organisations for all that they do on a day and daily basis to help those people who suffer from cancer cope better.
Derry Well Woman is there for all women who have been given a diagnosis of cancer, irrespective of where they are in relation to their journey, whether they've just been recently diagnosed, whether they've going through treatment, whether they're post-treatment, whether they've been re-diagnosed in recurrence, and right through to end of life. So we're there for all women, irrespective of where their cancer is. It's not a centre that's just site specific. We provide support for women who have breast cancer, bowel cancer, brain cancer.
I was diagnosed with cancer, breast cancer. I came here and to get help, and emotionally and mentally it was a great place for me to be without burdening the family too much. And for me to be here, it was helping me to deal with it in my own way, in my own time. And it was like being in a cocoon when you were in here, and then you got left and you went back out and dealt with things better.
Derry Well has 5 strands of cancer support. And probably the form of support that runs right through everything is our fortnightly cancer support group. And that's where women will be able to find the time and the place to come to terms with her diagnosis, to meet others who are in a similar position to herself, to be able to share her story unburdened really by the concerns of talking to family. It's her place. So the support group is very key and central to all that we provide. The other elements of the programme, we have 2 elements that are one-to-one, and that's for women who want to take time out, who need additional support. We have a very good counselling service run by a small team of counsellors who are experienced and qualified in supporting women to come to terms with her diagnosis, to come to terms with bad news, to come to terms with how to cope with family and how to tell their family if there's bad news. And really it's to get the strength to find their own self-healing. We have a team of complementary therapists who provide therapists right through from really non-touch to gentle touch, through to more contact therapies like Indian head massage, reflexology, aromatherapy, and women are obviously assessed complementary therapy to make sure that they're getting the one that's most appropriate for them. And a lot of women find that complementary therapy is a way of coming to terms with things without actually having to tell their story over and over again. We have our 2-day cancer programme, we have the cancer support group, and we also have a specialist programme, which is the WELL programme, and that's a 36-hour, what we call behavioural medicine programme, which is a very fancy term for something which supports women to find a whole range of options to support her through improving maybe her diet, looking at exercise, and I suppose that brings me to what is unique about Well Woman. I think that the whole programme is designed to look at all dimensions of a woman's well-being.
I'm glad you were able to come. You've been referred by the WELL programme to come and talk.
We've had women who have come just when they've been diagnosed. We've had women who have come when they're going through treatment, who are going through recurrence perhaps, and we've had women who have come to us when they're at the end of life. All of their dimensions of well-being are looked at, not just the physical, not just the fact that they're not sleeping, not just the fact that they're emotionally unsure and uncertain, but that their spiritual dimension, how they are psychologically, mentally, all of these are encapsulated within the types of programs that we offer. People are coming to us, first of all, because of the diagnosis, but very soon within Derry Well Woman, they find other people who are just like themselves, who are on the same or similar type of journey. And undoubtedly, a cancer diagnosis is a time when there's huge loss.
There's people who are diagnosed now with the same cancer as I had, so I can come here then and help them to deal with it because I've walked at the same shoes, and they can help when they see me how far on I have been. It helps them to deal with it better.
A cancer diagnosis is a huge upheaval and a storm in your life, and you'll lose things in that storm, but you'll also find on the shore new things that have washed up, new strengths, new abilities, new ways of coping, and that's what Well Woman's there about.
In the Western Trust area, in partnership with the Altnagalvin Hospital, we provide quite a few services here in Agnes Jones House, and that would include the counselling service, which is a vital service for people coming to the end of treatment. We also have art therapy and creative writing for people, because everyone's different. There are more than 12,000 people diagnosed with cancer here in Northern Ireland every single year, and each one of them will need a slightly different type of support to help them find the new normal. We also provide a bra and swimwear fitting service for women who have had breast cancer, so they can feel secure and confident in their self-image at work, at play, on holiday, whether it's gardening or whether it's on the beach. And as well as that, of course, we also provide the Beauty for Life service, which is really about helping people reconnect with their self-image and their self-worth after a devastating diagnosis of cancer and the effect that treatment can have.
I had a mastectomy and reconstruction. That followed radiotherapy, which took me up to, I think, the end of October. So for me, it was just on a fast train, getting off at various points. It was appointments, various treatments, feeling very unwell, up and down. I never really got time too much to think about it, because for me, it was just something I had to do. When I was having my radiotherapy, I went to the counselling service, which was located at Agnes Jones House here in Derry. And I had several sessions over a 6-month period, which were pivotal for me because it helped me focus on where I needed to be, on what I wanted to do, And I kind of knew what I wanted to do, but by speaking to the counsellor and challenging some of the negative notions and the issues that were holding me back, it helped me regain that confidence to allow me to move forward. The services that I've used the Zest for Life course, which was it's like a life coaching course. And that was really important for me at the end of my active treatment because it was getting me back on track. It was helping me deal with the anxieties that I have, any issues, the low mood. It was all a lot to do with positive thinking and putting you back in, to where your new normal was, as everybody talks about, that the past, that was in the past, but how could you move on?
Another very important service we offer here in Altnagelvin is our prostate cancer support group for men who have been diagnosed with that type of cancer. It's a very, very vital group. They do a lot. They offer each other a huge amount of support. And I would urge any man newly diagnosed in the Western Trust area with prostate cancer to get in touch and find out about that. And then a further service that we have, which is actually delivered in the community, is our family support service. And that's for children and young people in a family where a significant adult, a mum or a dad, or a much loved grandparent has been diagnosed with cancer. All of these services, I must stress, are completely free of charge. There are no barriers to anyone coming to us to seek help, and we would urge everyone to do so.
Cancer Connect and I started in Enniskillen, indeed in Fermanagh, to support people affected by cancer and their carers. We saw a need for the service and the cancer charity has grown about 30% per year. We have a team of very caring and capable volunteers. We have a listening ear service and you can drop in anytime. We operate 5 days per week. We have our bra fitting service, our underwear fitting service. We have 2 trained fitters. We also have a range of headwear that we give away free to people who may experience hair loss. We also have a complementary service, a complementary therapy service, of which we have 2 therapists operating 3 days a week. And we do massage, aromatherapy, reflexology. We also have a rise and recliner chair service where we have about 48 rise and recliner chairs in the community on a loan service, and the clients will use them, and when they're no longer required we go and take them back and they're refurbished for another patient. We also have wheelchairs and a list of aids that we have that loan service, so that operates daily. We also supply hampers with healthy food options to our clients and their families where there's a need. We have never refused a request to date, so we do try to work with individual needs and requirements with the services that we provide. The charity's become better known. We have very high profile patrons in Nathan Carter and Lisa McHugh, and the charity's is becoming well known, certainly in Fermanagh and indeed in Northern Ireland. We also cross the border as well into some of the southern counties, so we'd be high profile in our own area. A person with cancer, when they arrive at our door, will be met by one of our caring volunteers, and he or she will be offered a cup of tea, cup of coffee. It's a very caring environment. We use candles a lot, and it's very soft. It's like Granny's house, somebody said one time. So when you arrive, there won't be automatic doors or anything like that. It's a very caring service that we try to provide there. We were very much part of the community, supported by the community to support the community.
Lauren was diagnosed with a brain tumour when she was 12 years old. Unfortunately, after her second brain surgery, she developed a lot of complications and she was in a coma for quite a while. She developed a lot of life-threatening conditions and she suffered a lot of side effects from her tumour. So she has got conditions which require that her limbs swell up, and she's on a lot of dependent on a lot of medication on a day-to-day basis.
Action Cancer is a Northern Ireland-wide charity. We've been around for 40 years now. In the Northwest we offer a number of services. We offer counselling, complementary therapy and one-to-one life coaching in a group setting and one-to-one for anybody who's been affected by cancer. So we work with the whole family, we work with children right up from the age of 5 up.
We are obviously in a stressful time of our lives. Lauren is continuing to have a lot of treatments, a lot of investigations. We have rushing to a lot of hospital appointments. It's just great for us, the two of us, to be able to get time out for ourselves in a relaxed atmosphere and to have just a relaxing time and try and de-stress with all the mayhem that can happen around us on a day-to-day basis.
Reflexology, aromatherapy, massage, bachelor remedies, they all help people relax, learn techniques for helping them cope with the stress. It can help with sleeping, with tiredness, with fatigue, concentration levels. And we find that particularly good for all ages, including children and young people. We work also with and do one-to-one coaching, which is really good for anybody who's been through the cancer journey, is maybe trying to get back to work, back to normality. This provides them with sort of re-motivation and re-energises them. We do one-to-one counselling as well, and that's really a safe, confidential place for people to talk through their emotions and learn ways to cope. So as I said, these are available for children, young people, anybody impacted by cancer, including family members and friends. All of our therapists are trained specifically to work with cancer, so our complementary therapists adapt their practices for children, young people and adults who are impacted by cancer, because just for safety of practice. It would be the same with our counsellors, they're all trained specifically to work with cancer. We offer services throughout Northern Ireland, but in the Northwest particularly we work with a number of community organisations and statutory partners who really help us deliver and promote the services. So in Derry we work with Derry Well Woman, we work with the Pink Ladies, we work with Strabane Health Centre in Strabane and Limavady Community Development Initiative in Limavady. So it provides open access really to people in local community settings. There are nearly 70,000 people living with cancer now, and many of those are surviving cancer, but they do need that emotional support that they may not necessarily get within a healthcare setting, and we are seeing an increased demand for services.
It's wonderful to have reflexology and massage with Action Cancer, as I get a better quality sleep at night and I can get away from the hospital environment just to relax for a little while.
Hi, I'm Lisa and I'm a Macmillan Benefits Advisor.
I wonder, would you give me
When people hear the name Macmillan, they often think about nurses. And we have excellent Macmillan nurses and doctors here in the Western Trust who help you through your cancer journey right from diagnosis to the end of life. But we also provide a whole range of other services, including our Macmillan Benefits Advisors.
Right, Madeline, you've brought a form. What we do here is make sure that you get the best financial advice available.
And the Macmillan Benefits Advisors are here because we know that cancer has a very significant impact on people's lives and on their financial circumstances. And so the Macmillan Benefits Advisors will sit down and they will help you to apply for the benefits that you're entitled to, because many people don't know that they're entitled to anything. And they'll also help you to apply for Macmillan Grants, and the Macmillan Grants just give you that little bit extra to help you through a really challenging and difficult time. So here at Altnagalvin we also actually are developing a really exciting new state-of-the-art Macmillan Information and Support Centre, and that'll be housed within a wider health and wellbeing campus. So that centre is a really lovely, relaxing and welcoming place where anyone with a diagnosis of cancer from any place can come along, sit down and be talked through tailored information that's suitable to meet their needs. There will be a whole range of other services there, things such as complementary therapies and counselling, exercise classes, to name just but a few things. So we have a Macmillan Information and Support Manager here in the Western Trust, and she has recruited and trained a team of volunteers who will help to support her in really just sitting down with you and explaining and talking through information to help you just to understand it. And it's information about a whole range of things, not just about your cancer, but about things like what benefits you're entitled to, also things like maybe your travel insurance or how to get travel insurance. These are all things, how to talk to your children about the fact that you have cancer. These are all things that you know are needs for people whenever they get a diagnosis, and for you to be supported. So not only do we have that here in Altnagalvin, but we're actually developing a centre right in the heart of the new radiotherapy centre, and also out in the new Oma Hospital and in the Southwest Acute Hospital in Enniskillen. And it's about getting the right information at the right time and in the right place. So out there in the High Street, we also have our partnership with Macmillan and Boots, and that is providing information pharmacists to be able to help people to get that information right there on the High Street. And there are beauty advisors there to help people who have maybe lost their hair or need other advice or support on site. We have information, Macmillan Cancer information, in every library now across Northern Ireland, and it's just making that information accessible to people and helping them to be signposted to other services within their local area. So don't also forget about our Macmillan website, where there's a whole range of information and resources that are free of charge. We also have a helpline. It's available from 8 o'clock in the morning till 9 o'clock at night. The phone number is 0808 808 0000. And on that helpline, you can talk to someone about your cancer or about a wide range of other things that you might need in terms of practical and emotional support. And sometimes it is easier to talk to someone at the end of a phone than it is maybe face to face, and it is available outside working hours. So please do avail of the helpline and the website.
The welfare advisor that you see will let you know what you're entitled to and help you to fill out the forms.
That's great, thank you.
Hello ladies, thanks for coming along to our breast awareness session. I would like Michelle to maybe hand you out some leaflets and I'll explain what's in the leaflet. The Pink Ladies started 10 years ago with a focus group who, one lady figured a lot of people in her neighbourhood seemed to be getting diagnosed with breast cancer, and some of them were quite young, but there were no support groups or facilitating places for them to go outside of the medical setting. So they started a focus group and had a meeting, and it grew out of that. And we've just had our 10th anniversary in May, at which we did quite a bit of celebrating and celebrated our growth. Starting to feel your own breast now. I would rather you use this model. The Pink Ladies is primarily a support group who, if you've come along, you're probably quite scared when you come. So our aim is to put people at their ease, invite them to coffee mornings, and then we have a monthly support meeting at the last Tuesday of every month, and that's for new members as well, to come along and feel that they can integrate and be part of the group. There has been an increase in cancer diagnoses across the board. The membership has grown quite a lot from the beginning, but I think it's because we raise such awareness out there and take a bit of the taboo out of having to hide at home because you've been given a cancer diagnosis. It actually did start just for the ladies. But 2 years ago we branched out we actually just started as a breast cancer support group, and we've had other people with different cancers coming to us, so we decided we would open it to all cancers. And 2 years ago we inaugurated our men's group, who incidentally called themselves the Pink Panthers, and they're growing and going quite well. They have a monthly meeting as well.
That's the difference, the 2 fingers.
Well, initially it's to let them know that there are survivors, and take a bit of the fear out and let them know what's out there, and a lot of awareness about different services that are available to them. Within the Pink Ladies we also run art therapy classes, writing, creative writing, and glasswork, things that are productive. When you've had cancer you feel non-productive, It's one of the big, especially from a female point of view. And so we have actually produced a poetry book, believe it or not. And we just try to keep ourselves busy. To raise awareness, we run breast health awareness sessions, and we will go with whoever asks us.